Good morning, Matt. Hey, Dan. Test, test.
Hi, Megan.
Hey, Megan.
Hello.
Oh, so if you want to try and share your screen, I can see and hear you, so that's a good start.
All right, let me pull up. Oh, that's not. Oh, I'm going to give everyone a couple more minutes to filter in, and then we'll get started shortly here. All right. So it seems like a fair number of us are here. So first, I'd like to remind people to make sure that your mics are muted. Um, And I will also apologize if my dogs start barking because there's no way that I can mute myself. So I'll get started then. So my presentation is called The Therapeutic Efficacy of Yoga for Common Primary Care Conditions. This is actually based off a paper that Adrian and I are writing. It's not quite done yet, but I took all of the research that we had done for that and put it into this. So that's why Adrian gets credit for this as well. So we don't have any financial disclosures. And for our objectives, the first thing that we're going to go through is to kind of define what yoga is. And then we'll talk about what the top reasons for primary care visits are. And then we'll talk about the evidence behind yoga as a therapeutic treatment. In an ideal world, we would have also tried some yoga, but unfortunately, that would be a little difficult to do with the virtual setting. So, can anyone tell me what they feel like yoga is?
A physical activity that involves stretching as well as mental exercises and relaxation.
Yeah, that's a great definition. So, yoga is a system of health promoting attitudes and behaviors, and it arises out of the Hindu philosophy. It includes breath control, so kind of like you said, body postures, so the stretching. And then a 2017 national survey looked at how many people practiced yoga in the last 12 months, and they found that about 1 in 7 Americans have practiced yoga in the last 12 months. So, what do you think are the top 10 reasons that people come to primary care?
Chronic low back pain.
Yes, that's definitely one of them.
Move.
Yep. Mm-hmm.
Headache.
Diabetes, blood pressure.
Yep. Diabetes, headache. All right. So the top 10, the actual, this is for developed countries. So that the number 1 would be hypertension. Number 2 is URIs. 3 is depression and anxiety. 4 is back pain. 5 is health maintenance. Then we've got arthritis, dermatitis, AOM, diabetes, and cough. I feel like cough kind of fits with the URI, but that's. So today we're going to focus on how yoga impacts the top 5. There's not really, we didn't really look into upper respiratory infections just because we decided to focus a little bit more on the other ones. In order to look what the evidence is, we did a PubMed search with yoga plus the related condition, and then we also did a separate one to look at safety. And we included all meta-analysis, reviews, systematic reviews, and randomized control trials. We limited it to English language and ones that were published between 2010 and 2020. So only recent stuff. So that brings us to our first case. So we have Linda, who is a 61-year-old woman who comes to see you for routine health maintenance. She has a history of hypertension, which she prefers to manage without pharmaceuticals. She has been thinking of joining a gym with a yoga studio and wonders if it might help her hypertension more than her usual exercise of walking 30 minutes a day. Just reading that or hearing that, do you guys think that yoga would help for this?
think it kind of depends on all the factors that are contributing to her hypertension.
Yeah.
But it certainly could if like persistent anxiety or panic maybe causes some elevation in her blood pressures.
Okay. So it sounds like what you're thinking is that like if most of her hypertension is due to not necessarily relaxing, that she would have more of a benefit from yoga. Is that correct, Parker?
Yeah, I think that certainly like there's some cardiovascular benefits to yoga as well. So she'll get those same benefits as she gets with walking, but that they're depending on um, what she does for how strenuous her walking is or how contributory maybe some mental health issues are with her persistently elevated blood pressure, she might get a little bit more benefit.
Yeah. All right. So, the evidence for yoga for hypertension, there have been 4 systematic reviews and meta-analysis in the last 10 years. As you can imagine, with any yoga or integrative medicine study in general, there's a high degree of heterogeneity. A lot of times, the practice of yoga is not the same across the different studies. The control groups are not the same, so there's lots of differences. There's also a high risk of bias because if you can imagine, the people doing these studies probably pretty much believe in that yoga is going to help. So high risk of bias, and a lot of times there's not a ton of like great controls for these studies. However, when you combine them all together, you obviously get a little bit better data. So despite all of these issues, all of them found that there is some degree of statistical significance for both improvement of systolic blood pressure as well as diastolic blood pressure with yoga compared to usual care. For systolic blood pressure, that ranged anywhere from 4 to 11 millimeters of mercury, and for diastolic, that was anywhere from 3 to 7 millimeters of mercury. So I kind of want to then break down into the different ones a little bit more. So one of the more recent ones, the 2019 systematic review, did a meta regression analysis. So it looked at what ways can you decrease blood pressure the most with yoga. So for systolic blood pressure, what they found is that patients who had hypertension, so who were diagnosed and were over 140, for their systolic blood pressure with yoga techniques that included breathing and then had average methodological study quality and controlled for publication bias. We actually saw the biggest decrease of around 11.3 millimeters of mercury. And the confidence intervals were about 14 to 8 as well for that. For the diastolic blood pressure, they found that patients who had hypertension, so again, diagnosed with hypertension, who were doing meditation as part of their yoga and who practiced yoga for greater than 3 times per week. And then again, the stuff to make sure that it's an okay study. They found that it decreased by about 5.5 millimeters of mercury. And confidence intervals for that was around 7.4 to 3.8. 3 of these looked at yoga versus exercise. The exercise differed in all of the different types of studies, like I said, but they actually found no statistical significance. So exercise and yoga were equivalent in decreasing blood pressure. So then the question is, would this even be a feasible change? As we know, it's hard to get people to make changes in their lifestyle. A lot of times, it's whether it's motivation or inability to go to a gym these days, especially. So this study took adult patients who were matched by their systolic blood pressures, and they either were randomized to in-person yoga class or home yoga via a CD and manual. versus no care or treatment as usual. Out of these patients, there was no change in blood pressure for the in-person yoga class versus the control, which is interesting. But there was a decrease in just the diastolic blood pressure of the home yoga versus the control. What's interesting for this is that the home group was actually given the CD and manual by a doctor or by a health professional who had no yoga training like no formal yoga training. So it showed that, yes, there isn't a ton of change when they did it this way. However, um, it did show that doing it at home and being given these things by potentially a doctor could decrease at least the diastolic blood pressure. All right, so that brings us to the next part of the case. So Linda then states that her mother has suffered a series of devastating falls over her life, and she is looking for an activity to keep her moving. She's wondering if there are other aspects of yoga that might be helpful to her as she ages. So, yoga does show some promise as a health maintenance activity for older adults. There was this fairly large meta-analysis that was done in 2019 that looked at physical functioning and health-related quality of life in older adults. So what it looked at was that yoga practice showed improved balance, flexibility, and strength when compared to non-active controls. When compared to active controls, so like other forms of exercise, they actually did see an improvement in strength and flexibility, but not necessarily balance. Yoga practice also improved aspects of the health-related quality of life compared to the non-active controls. There's also a 2018 meta-analysis that looked at the health-related quality of life and mental well-being, and they did show a medium-sized effect on the health-related quality of life and a small statistically significant effect on mental well-being as well. And especially it seemed to favor yoga interventions in domains of depression that was noted as well. And then there was also a 2016 meta-analysis on yoga and physical well-being, and they showed an improvement in balance and mobility in persons who are 60 years and older. This then brings us to some of the randomized control trials. So one that was done in 2019 had participants that were 55 years and older and had some diagnosis of mild cognitive impairment. They showed that they compared yoga and memory training as the two of their see which one is better. And they actually saw improvements in memory with both of those. However, only yoga showed statistical significant improvement in overall executive function. And then a 2014 randomized control trial also looked at menopausal women. And it showed that there was a modest positive effect on menopause-related quality of life as well when people did yoga. And then kind of going off of the hypertension and other cardiovascular risk factor reductions. So this 2014 article was a meta-analysis looking at lots of different types of CVD risk factors. So it looked at BMI, blood pressure, LDL, HDL, all of those types of things. It included 35 randomized control trials. And I think the number of participants overall was around like 3,000 some healthy volunteers. It did show that yoga versus non-exercise controls improved BMI, blood pressure, LDL, and HDL. However, again, there is no difference between yoga and exercise interventions. So, what do you guys think? Would you recommend yoga for Linda, and why?
Heck yes. Let's start decreasing some of these risk factors.
Yeah.
And I think she can continue to do other exercise, but yoga is excellent for her.
Yeah, I agree. So just remember that yoga is not necessarily better than other exercise. So even saying to patients like, yes, it can help, but if you prefer to do other forms of exercise, that's okay as well. Really, the only thing that was different was the strength and flexibility that was noted for those studies on health maintenance between yoga and exercise controls. Any other comments, or people feel like they wouldn't necessarily recommend yoga?
I would recommend that she does yoga because it sounds like from the research that it's better than doing nothing. I mean, it's kind of on par with other things. Given what's going on with the world right now and like people's ability to go out and do other forms of exercise, I think this is like a perfect solution for a lot of things. So I would definitely recommend.
Yeah, absolutely. Especially with that study that also showed that doing it at home is just as effective, if not a little bit better, than doing it in person too.
I think there's, also the benefit of establishing a low impact exercise routine. So, I mean, should she later on in life develop some, osteoarthritis that might make long walks difficult, or already having this established is going to be easier than trying to get her working on it without having any background.
Yeah, exactly. All right. So that then brings us to our second case. So Mark is a 50-year-old male who has a history of depression and presents to our office for discussion of low back pain. He has had low back pain for years, has tried many different modalities, including NSAIDs, Tylenol, lidocaine patches, icy hot, and PT. He's wondering if there's anything else that can be done to help with his pain. His wife has been doing yoga, and he's wondering if this would possibly be helpful for his back. So, yoga for back pain. There have been several meta-analyses looking at yoga and showing that it does improve pain and function for back pain. So I'm going to kind of go through them in chronological order, starting with the most recent one. So this 2020, it was a systematic review that was published by the U.S. Agency for Healthcare Research and Quality. And it showed that yoga interventions were associated with improvements in pain and function. This was compared to attention or waitlist controls. And then yoga, when compared with exercise, did not necessarily show an improvement in pain or function. And so then the next one is a 2019 systematic review and meta-analysis that did show that yoga practice significantly decreased pain intensity. So this was looking at 13 different randomized control trials and kind of ranked things based on pain intensity and did show a significant decrease. The next one was a 2017 article that included 14 randomized control trials. And they talked about different positive aspects of yoga. Yoga compared to educational intervention improved function for people with low back pain. And yoga compared to exercise showed small improvement of pain and function, though that was not necessarily significant, statistically significant. And then the oldest one that we'll talk about here is a 2013 meta-analysis that looked at low back pain and pain-related function. And it did show that yoga improved pain. So this one actually had a Cochrane review, which was really great. It was done in 2017. It included 9 trials that compared yoga to non-exercise controls. And it showed that yoga was associated with improved function at 3 to 4, 6, and 12-month follow-up with small to moderate effect sizes. Yoga was also associated with improved pain at 3, 6, or 3 to 4, 6, 12-month follow-up when compared to, so improved function and pain, but again, not statistically significant. It was statistically significant, but authors didn't feel like it was clinically significant for the pain part. And then there's the yoga versus exercise control that showed no difference in function. And I'm sorry, I just saw a question that came in about the different types of yoga. Yes, absolutely. There are many different types of yoga, and I do think that that probably changes what specific things that improve. So whether it's function, pain, or if it really makes a difference between exercise and yoga. However, most of these kind of just compared yoga in general. And a lot of times they said that it would have to have at least 2 or 3 of the components that we kind of talked about at the beginning, whether that was breathing, the body postures, and the meditation for most of these studies that they included. I hope that answered that question. I didn't fully get to read it because it went away. So that then takes us, that showed that yoga didn't really make much of a difference for function when compared to an exercise control, but it did improve pain at intermediate follow-up, but just not at the short term. So overall, this kind of shows that there's a growing body of literature demonstrating that yoga is moderately effective when treating chronic low back pain. So Mark also notes that his mood isn't as good as it used to be, despite continuing to take his SSRI regularly. His wife has been saying that yoga has been helping his mood. He's wondering if there's any truth behind this. So we're going to separate anxiety and depression because most of the studies and systematic reviews actually separated them and didn't necessarily look at them together. So yoga for depression, about 84% of people stated that practicing yoga reduced their stress levels, and 67.5% of people stated that practicing yoga made them feel better emotionally. This was a national survey done on Americans, if I remember correctly. So there have been some proposed mechanisms about why exactly yoga would improve depression or anxiety in general. They've done some functional MRI studies that actually did show that GABA levels were increased in the thalamus after practicing yoga, which is kind of interesting. So that might be one of the mechanisms that it works by. So there are only 2 systematic reviews and meta-analysis looking at yoga and depression. Again, high heterogeneity, high bias. Again, because this is yoga, so there's lots of different forms of yoga. There's lots of different ways to practice it, whether it's the number of times or the different body postures, all of those different things. But they did show moderate evidence for short-term improvement of depression severity with yoga versus usual cares. And there was no difference in the change of depression for yoga, exercise, or antidepressant medications. I would like to really highlight that because we think of our antidepressant medications as being better than some of these things. But it actually showed no difference in yoga, exercise, or antidepressant medications. So all of those things can be very effective for helping with depression. All right, that brings us to anxiety. So there was only one systematic review and meta-analysis for anxiety that was done in the last 10 years. This included 10 randomized control trials, and it did show some short-term evidence for improvement of anxiety with yoga versus no treatment. And yoga actually did better than some of the active controls. I think that kind of makes sense because if you're doing some breathing exercise and meditation, we know that those things help with anxiety. So it would make sense that yoga would do better than some of the active controls there. But the other question is this even something that will last for a long period of time, or is this something that like while they're doing it, they feel better and then they the next day or whenever they start feeling worse again? So this study was more of an observational study that took cancer patients. They did 8 weeks of yoga. So that was a 60-minute yoga class, one time per week. And then they waited for a 6-month follow-up after they were done with the yoga sessions. And they actually did see continued improvement in both anxiety and depression for these cancer patients. 69% of them were also still practicing yoga at the 6-month follow-up. So that also shows that it is doable to continue for a long period of time as well. So what do you guys think? Would you recommend yoga for Mark?
Yes, Megan. Oh my gosh, there's so many health benefits, especially when we look at wanting to improve lower back pain function. Although pain was not significantly discussed, but it was still, there could be improvement with function and maybe some pain, because I know patients also mentioned it. But then also in helping with mood, including depressive and anxiety symptoms.
Yeah, absolutely. Yeah. So he would be an excellent candidate. But then he asks you this. So Mark's daughter attends a class at a power yoga studio. Their website depicts highly flexible young adults in challenging positions, including a headstand. Mark asks you if he should maybe go to that one. So that brings us into safety. So how safe is yoga? Only about 2.2% of participants experience yoga-related adverse events, and only 0.6% of these are serious. Other exercise interventions like running or any other type of exercise intervention have similar adverse event rates, so that's not necessarily different than exercise in general. The most common adverse events are for those experiencing back pain in general is a temporarily increased pain, but typically that does get better over time. And more serious events tend to happen with different types of positions. So whether that's headstand, shoulder stand, lotus position, which is kind of putting your feet up on each side, and then postures requiring one or both feet behind the head. Also, intense, forceful breathing practices can cause some issues too. So that brings us to our conclusion. I'm sorry, this was a little bit faster than I was expecting. Oh, is there increased risk with hot yoga? We did not necessarily see increased risk with hot yoga, and that was not necessarily discussed. I can see some people just not liking hot yoga as much as others, but I do know that hot yoga helps loosen muscles a little bit more so that it is easier to get into those more flexible positions. But really, it's the different positions that make the difference.
Megan, just
Yeah.
one more thing I would add, just so like for the like osteopathic perspective, we see a lot of people for OMT for chronic low back pain. And one of the first things I always assess is core strength, because a lot of times if people have, well, a huge number of people in the population have really poor core strength, and then all of that load gets put on their lower back. And I think yoga, if done with like appropriate poses and at an appropriate level, can really help people with that. And I think in turn that will help their back pain.
Yeah, exactly. So in conclusion, yoga is a system of health that promotes attitudes and behaviors that arise out of the Hindu philosophy. And it typically includes at least 3 different things. So breath practices, body postures, and meditation. There are lots of different top primary care conditions per visit, but the top 5 are hypertension, URIs, depression, anxiety, back pain, and health maintenance. And yoga has been found to be effective for improving both all hypertension, back pain, depression, anxiety, and overall well-being. So it's highly recommended for most of our patients. Big thank you to Adrienne Hampton, and then Serena Schrager as well, for she's helping edit or look at our paper, and then also to Tressa for getting all of this stuff set up every week.
We have another question, Megan.
Oh, okay.
Is there a place to give quick handouts on key techniques to do for specific diagnoses?
Not that I am aware of, actually. So that's, I would take a look at the integrative medicine site for UW, but I'm not entirely sure if they have one specifically for yoga and these specific conditions.
I have a quick question as well.
Yeah.
This is Kim Keys. You might not know me. I'm just got forwarded this link because I'm a yoga therapist.
Oh, awesome.
And I just wanted to mention that there are those of us that are trained as a yoga therapist that specifically are trained for different situations like chronic back pain or, hip replacements and things like that. So I would highly advocate for having some kind of referral or connections or ways that primary care physicians could refer to specific classes that are more appropriate. Because the yoga that I teach are much more appropriate for these populations that you're talking about than for somebody to walk in and do a power yoga. that they could very well get injured if they're not coached and supported and doing things in a way that aren't harmful.
So then my question for you, Kim, is how do we find these classes and how do we how do we show our patients how to get to you?
That's a good question. I've kind of been thrown into. I work at UW as well, so I have a lot on my plate as far as doing a lot of writing. But I've been kind of forced into trying to figure out how to get myself online. Otherwise, for me, I've actually struggled in trying to get into places where I've got more connection with the health system. So that is something that I would like to work on, and I'm starting to talk to some clinics that are really interested in bringing in more mind body modalities, not just from counselors. Somebody who actually has the mind body practices with yoga. So it's such a new field right now, and we're not licensed, so it's a big barrier to get integrated into the health systems because they don't know how to pay us, or they don't want to pay us, like an exercise instructor, and we need a little bit more than that for the amount of work that we put into things.
Yeah.
So, yeah.
Okay.
I'm open to conversations, though. I'm in Madison, so.
Well, this is great. Thank you.
Yep.
This is Adrienne Hampton. Thank you, Kim. I would point people to the American Center and to Research Park, where they have some mindful movement classes for medical populations. In COVID times, that all looks weird, but generally, that is a pretty safe referral. And then also, I have an underground yoga therapy practice at Northeast. So if you're at Northeast, you can send your patients to me for yoga therapy. And I would love it if the person who referred came to the visit to just like see what we do. That is also an option.
Yeah.
Wait, I have a question too, Megan.
Yeah.
Like within the setting of COVID times and like trying to minimize like patient interaction with like large group settings, do you ever direct anyone to like any specific, I don't know, YouTube channels or things in which people routinely do yoga therapy that's like probably more introductory for these patients?
I haven't. Adrian, I don't know if you have.
Yeah, so Scott Anderson and Alignment Yoga have, they might even have a YouTube channel at this point, but they have videos that can be very helpful. That's who I studied with, and I find their approach to be appropriate for a medical population. And then, I would also look at the online offerings from the UW, because they tend to be gentler, more mindful, more appropriate for a clinic population.
And I have a question too. There can be a lot of variety in like timing of different yoga classes. Is there a specific amount of time that people should kind of aim for in order to have the benefits that they want?
Yeah, so, and that was also seen in a lot of those studies where I know specifically in the hypertension one, in order to see the biggest difference in, for instance, diastolic blood pressure, you needed to practice at least 3 times a week. And I want to say that was at least, it was like an hour of practice 3 times a week. But other ones like the anxiety, and depression that looked at cancer patients, that was once a week for 8 weeks, and it was 60 minutes once a week. So there's a huge variety of the amount of time that they looked at in all of the different studies. So I don't think there's a great answer for that.
Yeah, I think with my practice and myself, I advise my clients to not go more than 3 days without engaging in the practice, just because there's certain physical patterns that we bring in ourselves into with our mind and our bodies that become chronic. And in order to create a change or maintain and work with those, they usually come back within a few days if you don't. If you only do it once a week, that's probably why you're seeing that 3 times a week there. Because there's a neurological reason.
All right. Well, I have all of my references listed here at the end if anyone wants to take a closer look at any of them. But then I guess if there are no other questions, we can wrap up a little bit early.
Great job, Megan.
Thank you.
Thanks, Megan.